Welcome back to the UNC OBGYN Quality Improvement Toolbox Lecture Series. Today we're going to be talking about driver diagrams. A driver diagram is a tool that helps you answer the question, what changes can we make that will result in improvement? It's a way to take the myriad of causes you came up with in your fishbone diagram and prioritize them, then make a concrete plan of action for your project. Let's take a look at the anatomy of a driver diagram, and then we'll talk about each of the individual components. You're going to start with your aim statement that you came up with at the beginning of your project and fill it in the upper left box. Next, we're going to be looking at primary drivers and secondary drivers, and you're going to fill these in from the brainstorming ideas that you came up with when you were making your fishbone diagram. Finally, you're going to come up with specific measures for your project, and once you have those measures, you'll be able to plan your first PDSA cycle. So what are primary drivers? These are the high-level factors you need to influence to achieve your aim. If you look back at your fishbone diagram, primary drivers represent the major bones or the categories of root cause that you brainstormed. In this example, when we were thinking about our project to increase TVH rates, a primary driver might be the patients that are involved in the surgeries. The secondary drivers are simpler, measurable components of each primary driver that can form the basis for specific projects or actions. If we look back to the same fishbone diagram, the secondary drivers represent the finest, most terminal bones in the diagram. In other words, the most specific possible causes of your problem that you found after you drilled down and down and down by asking why over and over again. Let's look at a non-medical example project and build a driver diagram together to see how it's done. Let's say I want to decrease my fuel costs by 25% over the next 3 months. How do I build this driver diagram? I built a sample fishbone diagram that might come out of brainstorming about this project, and we'll see how we fill these things into our driver diagram. When I'm trying to decrease my fuel costs, there are a couple things that go into it. I can look at the methods that I use when I'm driving. Everything from the miles that I drive per week, and things that go into that are whether or not I drive or carpool or walk or bike to work or use public transit, and then also my driving pattern or style. I can also look at the equipment. Particularly, I can look at the fuel efficiency of the car I drive, which is influenced by the type of car and the maintenance that I do on the car. And then I can look at other materials that go into this calculation for fuel costs, like the fuel price per gallon that I'm paying. And if we drill down into that a little bit deeper, that's influenced by, for instance, the choice of gas station that I make and the payment method, since cash is often cheaper than credit when you're buying gas. Now let's use our fishbone diagram to fill in our driver diagram. We start with a primary driver, which is, again, a high-level factor that we need to influence, and those are often the main bones on our fishbone. So first we can look at, for instance, the fuel price per gallon that we're paying. That could be a primary driver. But then the secondary drivers are the finer bones, the more concrete things that we filled in, which can be acted upon. For instance, the secondary drivers under this primary driver would be the choice of gas station and then the payment method that I'm using. Our next primary driver could be the miles driven per week, again, one of the more main bones from the fishbone diagram. Its secondary drivers are the very specific things that we thought of that influence miles driven per week. For instance, whether or not we carpool, whether we bike or walk to work, or whether we use public transit. And now the final primary driver I wanted to fill in was fuel efficiency, since this is another big factor that goes into our fuel cost. Now when I fill in our secondary drivers here, I want you to see that I was able to pull secondary drivers from different parts of the fishbone diagram. You can actually mix and match the fine, lowest level fishbones into the same primary driver if they both influence the same primary driver. For instance, both fuel efficiency of my car and my driving pattern or style influence my fuel efficiency. And whereas I had one under methods and one under equipment in my fishbone diagram, that really doesn't matter for the purposes of my driver diagram, and I can combine them into the two. They're both concrete, actionable items, in other words, secondary drivers, that influence my primary driver of fuel efficiency. Now we want to talk about the measures we're going to use for our project. In any quality improvement project, there are countless different things that you could decide to measure, but each one falls into one of three categories. Outcome measures are things that you measure in order to see if you're achieving the desired result of your project. In other words, the aim that you laid out in your aim statement. Now often, those things can't be measured until many months or years after you start your project, so it can take a long time to get that data. Process measures are things that you measure to see if the parts or steps in the system are performing as planned. In other words, steps in that process map that you made, you can measure things about those steps to see if they're happening as they should or when they should. And often you can get this data much faster than you can get your outcome measures. And that can help you influence your system or make changes to your system and not have to wait the many months or years sometimes that you need to wait to get outcome measures. Finally, balancing measures are a way to look at your system from a different perspective. You can think of balancing measures as a way to make sure that changes that you're making in one part of your system aren't adversely affecting other parts of your system unknowingly. So let's look at some examples of outcome measures in different projects. And I made these up off the top of my head just to show you what some examples would look like. Let's say you were doing a project on diabetes. An outcome measure might be the average hemoglobin A1C level for your population of patients with diabetes. Or in a project where you're looking at a medication system, you could look at an outcome measure of adverse drug events per 1,000 doses of medication given. Or, for example, in an outpatient clinic setting, your outcome measure might be the average wait time to see a doctor. In contrast to your outcome measures, which measure the final result of the changes you're trying to make, process measures measure whether or not the steps or parts in the system or process that you're working on are performing as planned. For instance, in your diabetes project, your process measure might be the percentage of patients who are actually having a hemoglobin A1C level checked, say, twice in the last year. Because obviously, if you're not measuring hemoglobin A1C on people, you're not even going to be able to tell if it's changing. For your medication system, you could look at the percentage of doses of medicine that were verified by 2 nurses prior to administration. And that's going to be something that might be much quicker to gather data on than the final overall rate of errors in administration of medicine per 1,000 doses. And for your outpatient clinic project, you could look at the average number of clinician hours available for appointments each day. Finally, for your balancing measures, again, these are looking at your system from a different perspective, looking to see whether changes you make in one part of the system is inadvertently adversely affecting other parts. So for your diabetes project, you could look at patient loss to follow-up rates. In other words, when you start getting really aggressive about controlling people's diabetes, do you have actually more people who don't come back to see you, which could artificially change the rates that you're getting for your hemoglobin A1C, but would actually be a negative influence on your health of your patient population. For your medication system project, you might look at the average time from the order to the administration of medication, because if you're putting systems in place to try to decrease errors, but it's drastically delaying administration of your medications, well, that might offset the benefit that you're getting from added safety. And for your outpatient clinic, you could look at the average number of minutes actually spent with a doctor by each patient. For instance, it wouldn't do a whole lot of good to decrease the wait time in your clinic if, by doing so, you cut in half the number of minutes that patients actually get to spend with a doctor. Because that's for a variety of reasons, as you could probably imagine, that would decrease the quality of your care, probably. Now let's look back at our driver diagram for our sample project for reducing our fuel costs. In the lower left corner, in the measures box, you'll see that there are 2 different areas. One for outcome measures, which are also described as AIM or primary drivers, and one for process measures, and that category is also labeled with secondary drivers, and you'll see why in just a second. So if we think about some of our outcome measures for this project, things that we can measure related to our outcome would be our total fuel costs, our average price per gallon that we're paying, our average miles driven per week, or our average fuel efficiency, or average miles per gallon. As you see, those things, they are measures of things directly related to our AIM statement or to our primary drivers. Those primary drivers are big overarching factors that we have to influence to achieve our goal. But you can see that each one of those things, each one of those outcome measures, would take a while to gather data on. If we're looking at average miles per week, you're going to have to measure for a whole week at a time before you get that data. If you look at your total fuel costs, well, that's going to be for some period of time. That's likely going to be a week or 2 weeks or a month. It's going to take a while to gather that data. If you look at our secondary drivers, though, those are things that you can measure much more quickly. And really what you're measuring with those you're measuring your process. So you can measure how often you use GasBuddy.com, right? That's kind of a proxy for your total fuel cost, because that's a tool to help you find the cheapest gas. So by measuring how often you're using GasBuddy, you're measuring a part of your process for decreasing your fuel cost. But it's something you can measure quickly on the fly, and that theoretically, if you change how often you're using GasBuddy.com, for instance, you should be influencing some of these primary drivers, but you maybe wouldn't see that data for a little bit longer. You could also look at the percentage of days that you carpool or bike or bus, because theoretically, if you increase that percentage, you're going to decrease your total fuel costs, your average miles driven per week. But it's much easier and quicker to measure the percentage of days that you carpool than it is to look at a whole week or month at a time of your miles per week driven or your total fuel costs. You can get that data quicker. I did not list in this measurement box an area for you to list your balancing measures, but it's still really important to think about those. For instance, you might want to think about your total upkeep costs for your bicycle, including maintenance and a helmet and things like that. Because if you were to see that those costs rose dramatically and in fact offset the savings that you saw in your outcome measures here, like your total fuel costs, well, then you might determine that you're doing more harm than good with your project. Now I want to switch gears a little and talk about the sample case from the MICU in reducing ventilator-associated pneumonias. In filling in our driver diagram, we started with our aim statement to eliminate ventilator-associated pneumonias in the MICU within 6 months. Then we filled in primary drivers, or the high-level factors that we have to influence in order to achieve our aim. So the two things that go into having a ventilator-associated pneumonia, you have to have bacterial colonization, and then that bacteria has to be aspirated. But those are really hard, nebulous things to measure. So then we came up with secondary drivers, or concrete factors that could be influenced that would then feed into those primary drivers. So for bacterial colonization, the things that influence whether or not you have bacterial colonization of the oral pharynx are proper intubation technique, oral hygiene or care, the percentage of days that a patient spends intubated, patient isolation, and accidental extubation, which can lead to repeated intubations. Under the aspiration category, we identified the head of the bed, or the angle of elevation of the patient's head, which can influence whether or not the patient can aspirate easily, their sedation or their mental status, proper suctioning of secretions, the cuff inflation of the breathing tube, and then gastric overdistension. All of those things are concrete things that influence whether or not aspiration is likely. The outcome measure, or the one most related to the aim and the primary drivers, would be the number of ventilator-associated pneumonias per 1,000 ventilator days. But just by its definition, you can tell that's going to be a piece of data that's going to take a long time to gather. In other words, you're going to have to gather data on thousands and thousands of ventilator days to gather data on a fairly rare event. So to do this project, the team identified 5 of those secondary drivers that we previously listed. They called these 5 the ventilator bundle. These were 5 of the most important factors that are influential in determining whether or not a patient develops a ventilator-associated pneumonia. 5 things that directly influence the primary drivers that we mentioned. In other words, oral hygiene or care and number of days intubated directly influence whether or not there's bacterial colonization in the oropharynx. And head of elevation, sedation or mental status, and proper suctioning of secretions, those all directly influence the primary driver of aspiration risk, but in a very concrete and measurable way. In creating this ventilator bundle, what the team was then able to do is pick very specific, concrete things on the floor to influence or to work on, with the theory that if they measure the percentage of patients for whom all aspects of that ventilator bundle were optimized, that would be a proxy that they could measure much more quickly for how many patients would develop ventilator-associated pneumonias. In other words, it's hard to measure a rare event like a ventilator-associated pneumonia. It's easy to measure whether or not all of these things, which they know are important for developing ventilator-associated pneumonias, are being optimized. So if they measure and optimize those things, they can get much more rapid turnaround on data. In other words, they can influence their process more quickly, and they won't have to wait thousands and thousands of ventilator days on their unit to figure out whether or not they're having a positive influence. So in review, a driver diagram will help you prioritize the possible causes that you came up with in that fishbone diagram, and then help you decide which ones of those things to address in your quality improvement project. And then when you're planning your project, after you've come up with your primary and secondary drivers, thinking about outcome, process, and balancing measures will ensure that you collect the right kind of data to measure quickly whether or not your project is actually achieving the aims that you set out. So what now? It's time to get together with your class and get out your fishbone diagram that you made. Take your best ideas and fill them into the driver diagram as you saw. There's a blank template that will be included at the link at the end of the post-test for this lecture. Again, fill in the major bones into those primary driver categories, and then the minor bones, or the very concrete, low-level things that you brainstormed, into the secondary drivers. Those are the things that you can measure easily and influence quickly to be able to see if you're making the change that you want in your project. And finally, again, you're going to identify the outcome, process, and balancing measures for your project. Next time, we're going to talk about how you actually go about setting up a PDSA cycle and gathering data on those measures. Thank you for your attention. See you next time.